Good morning, students. Now, some students had requested to prepare a list of new drugs because INICET में न्यू ड्रग्स के ऊपर 2 से 3 सवाल होते हैं. So मैंने एक न्यू ड्रग्स की पूरी लिस्ट कंपाइल करी है और इस वीडियो में I'll take you through each drug in detail one by one. And there are around 125 new drugs that I've compiled. So I think this is going to be very useful for your preparation. Basically approved in recent years 22, 23, 24, 25, and I'm sure this new drug compilation is going to be very useful to you. So the first drug that is included is dupilumab. Now this recently has been approved for chronic spontaneous urticaria, making it the first new targeted therapy for CSU in over a decade. Now this drug is a monoclonal antibody, blocks interleukin 4 and interleukin 13 receptor signaling, and it is mainly used in allergic diseases. Then the next drug is setmelanotide. This is a melanocortin 4 receptor agonist. So it stimulates this MC4R and it is basically leads to weight loss. So it is approved for treating obesity due to Bardet-Biedl syndrome, which is a rare genetic disorder. The next drug is suzetrigine. Now suzetrigine is a selective inhibitor of NaV1.8, a voltage gated sodium channel which is expressed in the sensory neurons, and by inhibiting this it blocks the transmission of pain, and so it is a non-opioid analgesic for acute pain, offering an alternative to opioid medications. The next drug is mirikizumab. It is a monoclonal antibody that binds to P19 subunit of interleukin 23, and this mirikizumab is approved for the treatment of Crohn's disease and moderate to severe acute ulcerative colitis in patients who cannot take the conventional biologic therapy. Then we have guselkumab. Now guselkumab is a monoclonal antibody against interleukin 23 used in treatment of psoriasis, psoriatic arthritis and ulcerative colitis. Daptopotamab, it is approved for breast cancer, non-small cell lung cancer. It works by targeting a protein which is on cancer cells, which is called as TROP2. Then adagrasib. This is basically an oral medication used in NSCLC, that is non-small cell lung cancer. It targets the KRAS G12C mutation and it works by inhibiting this protein which is involved in the cell growth. Then we have berotralstat, which is a once daily oral medication used to prevent episodes of hereditary angioedema. It is basically a blocker of plasma kallikrein. So it blocks the activity of kallikrein, which plays a role in the development of HAE attacks. Then vanzacaftor, tezacaftor and deutivacaftor. These are components of triple combination CFTR, which is cystic fibrosis transmembrane conductance regulator modulator treatment. So if anybody asks you CFTR, so you should remember this combination, and this is used to treat cystic fibrosis in patients age 6 and older. Then we have lenacapavir. Now this is again an antiretroviral medication used to treat HIV, and it is taken by mouth or by subcutaneous injection. It works by binding to the interface between HIV P24 subunits. HIV के P24 subunits होते हैं, उनके साथ वो बाइंड करता है. Then we have selpercatinib. Now selpercatinib is a RET kinase inhibitor. So it inhibits the protein RET receptor kinase, which is mutated in the cancer cell and provides them with the growth signals. So it is medication and treatment of cancers who have an alteration in the specific gene, that is RET. So here the term is RET, right? Then tirzepatide, I think you all must be knowing also, since it's not a very new drug. So it is a GIP analog and a GLP-1 receptor agonist, and it is also used to treat obesity and diabetes. Then Gepotidacin is a new oral antibiotic approved for uncomplicated UTI in adults and pediatric female patients. It is the first new class of oral antibiotics in nearly 30 years and works by inhibiting the bacterial DNA replication. Now, इसमें क्या है specificity कि this drug actually acts on both the enzymes DNA gyrase and topoisomerase 4. So this is how it makes a little different from the other antibiotics. Then we have atrasentan. Atrasentan is an oral selective endothelin A receptor antagonist used to reduce proteinuria in adults with primary immunoglobulin A nephropathy at the risk of rapid disease progression. So it is again, remember, endothelin A receptor antagonist, right? Used in nephropathy. Then fitusiran is approved by the FDA for treating hemophilia A and B in adults and children aged 12 and older. It is basically siRNA, small interfering RNA therapy होती है, which lowers the level of protein called as antithrombin. And by reducing the antithrombin, it balances the blood clotting process and prevents bleeding episodes in hemophilia. Diazoxide choline is an extended release formulation of diazoxide for treatment of hyperphagia in patients with Prader-Willi syndrome. Revakinagene is an allogenic encapsulated cell-based gene therapy which is indicated in macular telangiectasia type 2. This is a very remarkable, I'll say, a new drug, because this patient, idiopathic macular telangiectasia, it's a neurodegenerative disorder and there is progressive visual blindness. And so for the patients of it is called as macular telangiectasia. So for these patients, it is almost a boon to get this drug. It reduces the visual blindness. Then Mudela. Mudela is a copper containing IUD indicated for patients who do not want pregnancy for up to 3 years. It is approved for 3 years. Here they can ask Mudela कितने साल के लिए देता है, तो 3 years. Then Quinodiol is a synthetic form of quinodioxycholic acid and it is indicated for cerebrotendinous xanthomatosis, मतलब radiolucent stones in well opacifying gallbladder, so in whom selective surgery would be undertaken except for the presence of increased surgical risk. So usme we can give Quinodiol. Then Vimseltinib is a kinase inhibitor and a CSF1R antagonist. It is used to treat tenosynovial giant cell tumor, specifically used when surgical removal of the tumor is not possible. This works by inhibiting the CSF1R. So please remember, CSF1R inhibitor is Vimseltinib. Then Penmenme is basically meningococcal group vaccine. It is a vaccine indicated for active immunization against disease caused by Neisseria meningitidis. Vimkunya is a chikungunya vaccine. Recombinant vaccine होता है for chikungunya disease. Berdazimer sodium is a nitric oxide releasing agent indicated for molluscum contagiosum. The new drug in the treatment of molluscum contagiosum is berdazimer. Iloprost is a prostacyclin mimetic. So this is used in treatment of severe frostbite in adults to reduce the risk of digital amputations and to secondly used in PH, that is pulmonary artery hypertension. So iloprost, basically it is a vasodilator because it is a prostacyclin mimetic and relaxes the blood vessels. Then Lifileucel is an FDA approved adoptive T cell therapy used to treat adult patients with unresectable or metastatic melanoma that has progressed after treatment. It is a tumor derived T cell immunotherapy, and meaning it uses a patient's own T cells that are expanded in the lab to fight the cancer. So please remember, this is a new type of adoptive T cell therapy for melanoma. Then letibotulinum toxin is an acetylcholine release inhibitor and a neuromuscular blocker. It is used in moderate to severe glabellar lines associated with corrugator or procerus muscle activity in adult patients. Then tislelizumab is a humanized immunoglobulin G4, IgG4, and a programmed cell death protein 1 monoclonal antibody, which is used in esophageal cancer and gastric cancer. So programmed cell death protein 1 monoclonal antibody है, and it is used in the treatment of cancer. Resmetirom is a thyroid hormone receptor beta agonist indicated with diet and exercise for treatment of adults with non-cirrhotic, non-alcoholic steatohepatitis with moderate to advanced liver fibrosis. So this is a drug which is used in liver fibrosis patients. Atidasertib automatacil is an autologous hematopoietic stem cell gene therapy for treatment of children with metachromatic leukodystrophy. So these are very rare kind of diseases, but for those rare kind of diseases, since there was no treatment available, patients just had no option. But now with the development of these drugs, new drugs, it is almost a इन पेशेंट्स के लिए नई ज़िंदगी है. Aprocitentan is an endothelin receptor antagonist. और endothelin receptor antagonist कहाँ पे हम यूज़ करते हैं? We use it in PAH. So like bosentan, now we have aprocitentan. Then another drug, macitentan, which is also a endothelin receptor antagonist, and tadalafil, which is a phosphodiesterase 5 inhibitor. This combination is also used in pulmonary arterial hypertension, right? Then next drug is givinostat. Givinostat is a histone deacetylase inhibitor indicated for treatment of Duchenne muscular dystrophy. Givinostat is the histone deacetylase inhibitor in Duchenne muscular dystrophy patients. Then sotatercept is an active signaling inhibitor used for treatment of adults with pulmonary arterial hypertension. Vadadustat is a hypoxia-inducible factor inhibitor indicated for treatment of anemia due to chronic kidney disease in adults who have been doing dialysis for at least 3 months. Danicopan is a complement factor D inhibitor used for treatment of extravascular hemolysis with paroxysmal nocturnal hemoglobinuria में हम यूज़ करते हैं Danicopan. It is a complement factor inhibitor. Then ceftobiprole Medocaril is a cephalosporin antibiotic for treatment of bacteremia. It's a new drug and used in these infections. Then ustekinumab is a human interleukin antagonist used for treatment of plaque psoriasis, psoriatic arthritis, and Crohn's disease and ulcerative colitis. Pegulicianine is an optical imaging agent for detection of residual cancerous tissue during breast cancer surgery. Nogapendekin alpha inbacicept is a first-in-class interleukin-15 superagonist for use in combination with Bacillus calmette-guerin for the treatment of BCG-unresponsive bladder cancer carcinoma. Tovorafenib is a type 2 pan-RAF kinase inhibitor for treatment of low-grade glioma. Pivmecilinum is a penicillin drug for use in UTI. Fidanacogene is an adeno-associated virus vector-based gene therapy for treatment of adults with hemophilia B. Then mavorixafor is a chemokine CXCR4 antagonist. It is indicated in patients with 12 years of age and older with VHIM syndrome to increase the number of neutrophils and lymphocytes. So it looks like a HIV drug. The drugs are similar to what they are used in HIV. Then tarlatamabis is a bispecific delta-like ligand 3 directed CD3 T cell engager indicated for treatment of adult patients with small cell lung carcinoma. Then aflibercept is a vascular endothelial growth factor inhibitor used for treatment of age-related macular degeneration. Wet age-related macular degeneration. There's another VEGF, that is bortezomib, and this is aflibercept. Then eculizumab. Eculizumab is a complement inhibitor for treatment of paroxysmal nocturnal hemoglobinuria. अभी हमने एक और ड्रग ऊपर देखी है. Mresvia is a modified RNA vaccine that may protect adults aged 60 years and older from lower respiratory tract disease caused by RSV infection. Imetelstat is an oligonucleotide telomerase inhibitor which is indicated for the treatment of adult patients with low to intermediate 1 risk myelodysplastic syndrome with transfusion dependent anemia. Elafibranor is a dual paroxysmal activated receptor alpha and delta PPAR receptor agonist used in primary biliary cholangitis. Sofpironium is a topical anticholinergic indicated for treatment of primary axillary hyperhidrosis in adults and pediatric patients 9 years of age and older. Crovalimab is a complement C5 inhibitor for treatment of paroxysmal nocturnal hemoglobinuria. Aflibercept is a vascular endothelial growth factor inhibitor used in wet macular degeneration. Is it the same one? Is there? Yes. So by mistake there is a repetition. Donanemab is an amyloid beta directed antibody indicated for treatment of early symptomatic Alzheimer's disease. This is a new drug in the treatment of Alzheimer's, donanemab. Then eculizumab is again a complement inhibitor used in PNH. Duroxolitinib, very difficult names. Duroxolitinib is a Janus kinase inhibitor indicated for treatment with alopecia areata. Paliperidone palmitate is an atypical antipsychotic used for the treatment of schizophrenia and schizoaffective disorder. Then afamatricin is a melanoma associated antigen A4, so MAGE A4. This is used for treatment in unresectable or metastatic synovial carcinoma. Then vorasidenib is basically IDH1 and IDH2 inhibitor, and it is used in the treatment of grade 2 IDH mutant glioma. Denileukin defitox is an interleukin 2 receptor directed cytotoxin indicated for treatment of T cell lymphoma. Oh, this is again a repeat. So aflibercept is a VEGF used in macular degeneration. Palopecteriparatide, it is an analog of the teriparatide drug indicated for treatment of hypoparathyroidism. Then nemolizumab is an interleukin 31 receptor antagonist for treatment of prurigo nodularis and atopic dermatitis. Seladelpar is a selective paroxysmal proliferator. It is a PPR delta agonist for treatment of biliary cholangitis. Axatilimab is a colony stimulating factor 1 receptor blocking antibody used in treatment of graft versus host disease. Lazertinib is a kinase inhibitor used in combination with amivantamab for the treatment of patients with epidermal growth factor receptor mutated non-small cell lung cancer. Atezolizumab and hyaluronidase is a programmed death ligand blocking antibody, and it is used for the treatment of many cancers like non-small cell lung cancer, small cell hepatocellular melanoma, and soft part tissue sarcoma. Then lebrikizumab is a targeted interleukin 13 inhibitor used for treatment of moderate to severe atopic dermatitis in adults and children who weigh at least 40 kilograms. Ocrelizumab and hyaluronidase is CD20 directed antibody combination used for treatment of people with multiple sclerosis. People with multiple sclerosis relapsing, they use this ocrelizumab and hyaluronidase. Then erimoclomol is a heat shock protein amplifier used in combination with miglustat for treatment of Niemann-Pick disease type C. Levacetyleucin is a modified amino acid for treatment of Niemann-Pick disease type C. What is that? Levacetyleucin. Then xanomeline and tropsium chloride is muscarinic agonist and antagonist combination for treatment of schizophrenia in adults. It's a new type of therapy. Xanomeline and tropsium chloride is muscarinic agonist and antagonist combination. Then fluoropyridaz F18 is a PET myocardial infusion imaging agent used for detection of myocardial ischemia and infarction. Inavolisib is a PI3K alpha inhibitor used for combination of PIK3CA mutated hormone receptor positive human epidermal growth factor negative breast cancer. So basically inavolisib is used in breast cancer. Then marstacimab is a tissue factor pathway inhibitor antagonist used for treatment of adults and adolescents with hemophilia A and B without inhibitors. This is simple. First carbidopa and first levodopa is basically carbidopa levodopa drug combination for treatment of motor fluctuations in patients with advanced Parkinson's. Zolbetuximab is a Claudin 18.2 directed cytolytic antibody for treatment of gastric cancer or gastroesophageal junction cancers. Then sulopenem and probenecid is a combination to treat uncomplicated urinary tract infection in adult women. Obecabtagene is a CD19 directed genetically modified T cell immunotherapy for patient adults with relapsed or refractory B cell precursor ALL. Eladocagene is a gene replacement therapy for use in the treatment of AADC deficiency. Nilotinib tartrate is a kinase inhibitor used for the treatment of Philadelphia chromosome positive chronic myeloid leukemia. Revumenib is a first-in-class menin inhibitor indicated for treatment of relapsed or refractory acute leukemia with this gene translocation in adult and pediatric patients 1 year and older. Zanidatamab is a bispecific HER2-directed antibody for treatment of HER2-positive biliary tract cancer. Acoramidis is a transthyretin stabilizer indicated for the treatment of cardiomyopathy or wild-type or variant amyloidosis in patients to reduce the cardiovascular death. Imatinib mesylate is an oral liquid formulation of approved kinase inhibitor imatinib used for treatment of certain forms of leukemia and other cancers. Then landiolol is an ultra-short acting cardioselective beta-1 blocker for the short-term reduction of ventricular rate in patients with supraventricular tachycardia including atrial fibrillation and atrial flutter. Then zenocutuzumab is a HER2 and HER3 directed antibody for treatment of patients with non-small cell lung cancer and pancreatic adenocarcinoma. Cosibelimab is a programmed death ligand blocking antibody used for treatment of squamous cell carcinoma. Crinecerfont is a corticotropin releasing factor type 1 receptor antagonist indicated as adjunctive treatment to glucocorticoid replacement to control androgens in patients with classic congenital adrenal hyperplasia. Then ensartinib is an anaplastic lymphoma kinase inhibitor used for treatment of ALK positives non-small cell lung cancer. Remestemcel is an allogenic bone marrow derived mesenchymal stromal cell therapy indicated for treatment of steroid refractory acute graft versus host disease in pediatric patients 2 months of age and older. Acellular tissue engineered vessel is first in class implantable bioengineered human tissue to treat vascular trauma. Then olezarsen is an ApoC3 directed antisense oligonucleotide inducted as an adjunct to reduce triglycerides in patients with familial chylomicronemia syndrome. Concizumab is a tissue factor pathway inhibitor antagonist. It is indicated for routine prophylaxis to prevent or reduce the frequency of bleeding disorders in hemophilia A and B. ड्यूटीवाक्राफ्ट और टेजाक्राफ्ट और वेंजाक्राफ्ट और ये हम पहले भी पढ़ चुके हैं. दिस इज़ बेसिकली अ कॉम्बिनेशन सिस्टिक फाइब्रोसिस CFTR. दिस इज़ अ रिपीट. I think this is also a repeat. Nivolumab and hyaluronidase is a cell death receptor, programs death receptor blocking antibody, and it is used in a lot of cancers, solid tissue cancers. Now, there are some drugs which are actually not very new, they are already there in the books, but since they are a little more new as compared to the very old drugs, so that's why I've included them. So, we have Tiprolicant, it is a drug which is used for narcolepsy. Licofalon is a combined COX-LOX inhibitor that is being investigated as a disease-modifying anti-osteoarthritis drug. Tofacitinib is again used in severe rheumatoid arthritis refractory to methotrexate. Pegloticase is used in treatment of chronic tophaceous gout. Sacubitril is a NEP inhibitor recently approved for CHF. Clevidipine is an ultra-short acting DHP recently approved for hypertensive emergency. It's a dihydropyridine CCB. It is used IV only, right? Then Selexipag is a drug called a selective non-prostanoid IP prostacyclin receptor agonist, and it basically relaxes the blood vessels in the lungs, so it can be used in pulmonary arterial hypertension, that is Selexipag. Then Vernaculant, we know it is an antiarrhythmic drug used to convert atrial fibrillation. So the drug is administered intravenously in atrial fibrillation. Mipomycin is an injectable medication to lower the cholesterol levels in patients with familial hypercholesterolemia. It is basically an antisense oligonucleotide. So it is administered subcutaneously and is used as an adjunct to other lipid lowering therapies and is a healthy diet. Lometapide inhibits MTP, preventing the assembly of VLDL and chylomicrons, and so it is used to lower the cholesterol levels in familial hypercholesterolemia. Elagolix and relugolix are new GnRH agonists, and they are effective orally. They are approved for treatment of pain associated with elagolix is approved in endometriosis. Relugolix is approved in prostate cancer. Romosozumab is a humanized monoclonal antibody sclerostin inhibitor. Please remember, it is approved to treat osteoporosis in postmenopausal women. Cinacalcet is used to treat hyperparathyroidism in patients with chronic kidney disease who are on dialysis, and for patients with hypercalcemia associated with parathyroid carcinoma. This basically works by increasing the sensitivity of calcium sensing receptors on parathyroid cells to extracellular calcium. Then we have etelcalcetide is a new CASR agonist. Please remember this CASR agonist indicated for IV treatment of secondary hyperparathyroidism with CKD on hemodialysis. जो patients CKD के होते हैं उनमें hyperparathyroidism होता है, उन patients में etelcalcetide is used. Then drospirenone. It is a synthetic progestin hormone used in birth control pills to prevent pregnancy, preferred in women who have fluid retention after taking OCPs. It's a synthetic progestin and it is used in OCPs to prevent pregnancy and treat other conditions also. Now, it is specifically known for its anti-mineralocorticoid and anti-androgenic activities, right? Then we have prasterone. It is an inactive steroid that is converted to estrogen and androgens and indicated for treatment of dyspareunia due to vulvovaginal atrophy. It is also known as dehydroepiandrosterone and used as an over-the-counter dietary supplement to correct DHEA deficiency in the old age as a component of menopausal hormone therapy to treat painful sexual intercourse due to vaginal atrophy, and it is taken by mouth, application to the skin through the vagina, or by injection into the muscle. Please remember this drug, prasterone. Then Micasamin rinfabate is a complex of recombinant human IGF-1 and IGF binding protein. It is indicated for growth failure due to deficiency of IGF-1. So that is micasamin. Then pasireotide is an orphan drug. That's why I've colored it, for the treatment of Cushing's disease in patients who fail or are ineligible for surgical therapy. Afrezza, we all know that it is basically inhaled, long-acting inhaled use insulin used with long-acting insulin in patients with IDDM. It is contraindicated in hypoglycemia in patients who have chronic lung disease, and because it has a risk of acute bronchospasm in COPD, so it is not indicated in COPD also. Then edaravone, it is a new drug approved for amyotrophic lateral sclerosis. So this is a medication used to treat stroke and ALS. It is given by IV infusion and by mouth. And this medication is basically an antioxidant, and so oxidative stress जो है उसको कम करता है. Most common side effects they include problems walking gait and bruising, contusions करता है. Monoclonal antibodies against this, I think we have done mepolizumab and restylizumab and monoclonal antibodies. This is also not a very new drug. Roflumilast, silumilast, toflumilast are basically PDE4 inhibitors. They are more used in COPD and as compared to asthma. Then fostamatinib is a SYK inhibitor. It inhibits SYK is what? Spleen tyrosine kinase enzyme. So this basically this is a drug used to treat chronic immune thrombocytopenia, right? Then eltrombopag. Eltrombopag is a new orally active thrombopoietin agonist approved for treatment of ITP. Then this basically, it is a thrombopoietin receptor agonist, increases platelet production by interacting with the TPO receptors transmembrane domain. Luspatercept is a new drug approved for treatment of anemia in patients with beta thalassemia and myelodysplastic syndromes. Then ticagrelor and cangrelor, they are both antiplatelet drugs. They are also not very new drugs. They block the P2 Y12 receptor on the platelets, prevents aggregating, and it is used basically in PCIs to enhance the platelet inhibition. Then vorapaxar is an antiplatelet drug, a thrombin receptor antagonist used to reduce the risk of thrombotic cardiovascular events in patients with a history of heart attack or peripheral arterial disease. Andexanet is also not a very new drug. It is basically used to reverse the effects of direct oral anticoagulants like apixaban and rivaroxaban in case of life-threatening uncontrolled bleeding. So it is basically Andexanet is a antidote, or I'll say antagonist to the DOAC, that is direct oral anticoagulants. Eculizumab and ravulizumab are monoclonal antibodies against complement factor C5, and they are used in PNH. This is again a repeat. Idarucizumab is a monoclonal antibody against dabigatran. So यहाँ पे हमने पढ़ा वो apixaban. Andexanet is a antidote to DOAC. Idarucizumab is an antidote to dabigatran, right? Then lubiprostone is used to relieve stomach pain, bloating, straining, produce softer bowel movements who have chronic idiopathic constipation. So this is also, lubiprostone is also used to treat irritable bowel syndrome with constipation. Then also used to treat constipation caused by certain opioid pain medications with chronic non-cancer pains. So this basically, it is a laxative. So remember, they can ask a question like lubiprostone does not, यहाँ पे डाल देंगे does not treat the following constipation. फिर वहाँ पे डाल देंगे IBS constipation, idiopathic constipation, non-cancer, chronic non-cancer pain constipation. So that type of question they can ask. Crofelemer is an antidiarrheal indicated for the symptomatic relief of non-infectious diarrhea in patients with HIV. So patients who are taking HIV, उनमें जो डायरिया होता है उसमें crofelemer हम देते हैं. Bezlotoxumab is a monoclonal antibody which is used to reduce recurrent Clostridium difficile infection in individuals at high risk. Then telotristat ethyl. It is a medication used to treat carcinoid syndrome diarrhea. It is a tryptophan hydroxylase inhibitor, reduces the production of serotonin associated with diarrhea in this condition. It is used in combination with somatostatin analog therapy. Then linaclotide is a guanylyl cyclase agonist for treatment of idiopathic constipation and irritable bowel syndrome constipation. Degarelix or GnRH receptor antagonist, is approved for treatment of prostate cancer. It inhibits the GnRH receptors in the pituitary gland, preventing the release of LH and FSH. And the last drug is tazarotene. It is a topical retinoid introduced for the treatment of psoriasis. It is basically used to treat skin conditions like acne, psoriasis, and in addition, it is also used to reduce facial wrinkling, discoloration in people who are using other skincare and sunlight avoidance program. So with this, we finish the new drugs version 1, and this, I think this collection is going to be very helpful for the students who are preparing for INICET, which is just 17 days from today.